This is Radio Health Journal. I'm Nancy Benson. This week, the changing face of HIV. Today, it's a treatable chronic disease, but it hasn't gone away.
People will say, oh, I didn't think that was the problem anymore. We still have HIV. I didn't know that was around, because it really has dropped off the radar.
Why we can't forget about HIV when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
The stallions may go off and form bachelor groups, which sounds an awful lot like a fraternity.
Are stallions the animal kingdom equivalent of frat bros? Then,
when he won the election, he was history. He was the first African-American president.
Exploring the photos from a historic presidency. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
When Radio Health Journal went on the air in 1992, one of our first stories, in fact in our second week, was about HIV and AIDS. Back then, nearly 28 years ago, the AIDS epidemic and the fear of contracting HIV was on everyone's mind.
When HIV was first recognized as a disease in the United States, people that were diagnosed were given usually less than 6 months to live in terms of their overall prognosis. It was really bleak. HIV would attack people's immune systems over a period of 10 years or so. Most people didn't know they had HIV until quite late into their illness, where they started getting these very unusual infections that someone with a normal immune system would not get. But because HIV had really decimated the way their body could respond to infections, they were popping up with all sorts of strange infections and cancers. It was really an awful way to die. A lot of people became quite sick with a wasting illness, diarrhea, sort of bedbound for a long period of time before they died. So it was a very, very, very tough time.
That's Dr. Laura Cheever, Associate Administrator of the HIV/AIDS Bureau of the federal government's Health Resources and Services Administration. She says the global search for a treatment found its target in the mid-1990s, but the cocktail of drugs that made HIV a manageable chronic disease were hard to take. Sometimes handsfuls of drugs on a rigid schedule.
And it really has only been in the last 5 or 10 years that the drugs have gotten easier to take, where many people diagnosed with HIV today can take one pill once a day and live a near normal lifespan. So really the whole situation has changed.
Today, about 20 million people around the world are on antiretroviral therapy, and death rates have dropped 55% since their peak in 2004. Of the roughly 1 million HIV/AIDS deaths worldwide in 2016, about 16,000 were in the United States.
HIV is a manageable chronic disease, but we have a big challenge in our country in that we have about 40,000 new infections every year in this country, and that number has not gone down for many years. And most of those are between the ages of 25 and 30. I think we have this bolus of people that are older because so many people were diagnosed early in the epidemic before we understood all those pieces of it. And so when people did understand about HIV, particularly among gay men, there were significant changes in behaviors and prevention strategies that were worked to bring down that number of diagnoses to 40,000. But right now, we're at about 40,000. And when we look at who's getting HIV today, it still remains a preponderance of men who have sex with men. But other populations are important as well. We know that 1 in 6 new diagnoses are going to occur among people that are over 50, so that's important to know. And about 20% of new diagnoses do occur in women.
The federal government has launched an initiative to end the HIV epidemic in the next 10 years, but getting the number of diagnoses down won't be easy. Cheever says one strategy is convincing people that HIV is still something to think about.
When I talk about HIV in my public life, people will say, oh, I didn't think that was the problem anymore. We still have HIV. I didn't know that was around, because it really has dropped off the radar. And I think that it makes it particularly difficult to get people to understand if they are at risk for HIV. So older people, for example, many times just don't consider themselves really at risk for sexually transmitted diseases. Older women aren't worried about getting pregnant, so they're less concerned about condoms and other use. So I think that that's definitely a major factor.
Cheever says even though infections are down, anyone can still be at risk, so everyone should be tested for HIV at least once in their life.
It's important that everyone get tested for HIV because many people at risk of HIV don't perceive themselves at risk. And it's important that people that are at higher risk of HIV are tested more regularly. So anyone that's having more than one sexual partner, young gay men, people who inject drugs should all be tested more than once.
If someone is found to be HIV positive, treatment is the next strategy, and there's no doubt it's remarkably effective.
Yes, so it's very exciting. Medical advances in the last few years have really showed us that if a person has HIV and they get on effective treatment for HIV and stay on it, they can become virally suppressed, which means we cannot really measure the virus in their blood. And people that are virally suppressed have effectively no risk of transmitting HIV sexually to other people. So it's critically important we get people on treatment. That said, we think of the 1.2 million people that have HIV in this country, about 400,000 are not in medical care. About 150,000 of those people have yet to be diagnosed, so we need to do a better job with diagnosis. And then we have about 250,000 people who were diagnosed, and some of them were never connected to care, or they were connected to care and did not remain in care for some reason. HIV, the stigma around HIV is still a huge problem in this country. And I've had one patient that came in a couple of years ago who said he would rather die of HIV than let his wife find out he had it. So people are making decisions like that because of the overwhelming stigma they feel around their diagnosis.
Cheever says the stigma persists, though the population of those most likely to contract HIV has changed over the last 2 decades.
Initially, for people living with HIV, when it first was a major problem in the United States, the populations that garnered the most attention were really among gay men, particularly gay white men in this country, and people who injected drugs. That has shifted. HIV in this country has really been a disease that's concentrated in poorer populations and in minority populations in this country. So in the Ryan White HIV/AIDS program today, about 3/4 of the people living with HIV are minorities. About 2/3 of them are living at or below the federal poverty line. And importantly, about almost half of them are 50 or older. And that's because we've had success at getting people onto treatment. And so now people are living longer and longer. So populations that we diagnosed in their 30s or 40s are now in their 50s. About 15% of people living with HIV in this country are 65 years or older. So the face of HIV really is half of people are over age 50, and most people in the United States don't recognize that.
But while low-income people make up the majority of those facing a new HIV diagnosis today, treatment is expensive. That's where the Ryan White HIV/AIDS program comes in. It's a federal program providing funding for treatment of more than 500,000 low-income people with HIV. More than half of those diagnosed with HIV in the United States.
We provide care and treatment to people that have no insurance, but as well the program provides care and wraparound services for people who have insurance but can't afford all the different components of their care and treatment. So about 80% of people in our program have some form of coverage, whether Medicaid or private insurance. But given their incomes, they just can't potentially afford all the copays, deductibles, premiums, other parts of their insurance, and we can help them with that.
And with treatment comes a nearly normal lifespan for people with HIV. We've come a very long way from the days 30 years ago when an HIV diagnosis was a death sentence.
Many people with HIV, the patients I take care of, most of them will not die of HIV or complications of HIV. They will die of prostate cancer and heart disease and other things. It is important to note that people with HIV do have accelerated risk of some chronic conditions like heart disease and diabetes and kidney disease. So those are all factors involved, but people can really live near normal lifespan and a very healthy lifespan.
You can find out more about all our guests through links on our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
With many opportunities to celebrate during fall and winter, preparing foods for all the festive occasions can be both a joy and a challenge. Selecting basic foods that can work in multiple ways, such as fresh grapes, can simplify things greatly. According to registered dietitian Courtney Romano, health advisor to the California Table Grape Commission.
Fresh grapes are inherently beautiful. They taste great and are easy to keep around for everyday eating as well as special occasions. Keeps them on hand for a simple and healthy snack option. Arrange them in a pretty bowl for a classic and edible centerpiece, or in small clusters to adorn a serving platter. Use them as a special ingredient. Heart-healthy grapes can be dipped in dark chocolate for a delightful dessert that is good for you, too.
Heart-healthy grapes from California are in season from May through January. Grapes of all colors, red, green, and black, are a natural source of beneficial antioxidants and other polyphenols, which may help contribute to heart health. Visit grapesfromcalifornia.com for more information.
It's National Alzheimer's Disease Awareness Month, as well as National Family Caregivers Month. The two go together since there are more than 16 million families and friends in the U.S. caring for someone with Alzheimer's. According to the Alzheimer's Association, 4 out of 5 caregivers say they'd like more support in providing care, especially from their families, yet 39% haven't engaged others in caregiving tasks. Ruth Drew, Director of Information and Support Services for the Alzheimer's Association, has suggestions on ways to help.
Make a standing appointment to give the caregiver a break so they can run errands or go to a support group. Caregivers often feel isolated or alone, so check in with a phone call or stop by for a visit. And when you offer support, be specific. Say, I'm going to the store, what do you need, rather than call me if you need anything.
People overwhelmingly agree caregiving for someone with Alzheimer's should be a group effort. Find more tips and resources for caregivers at alz.org.
This month is Movember, a time for men to think about their prostate health. But it's not just prostate cancer. Far more men are affected with a non-cancerous prostate condition, benign prostatic hyperplasia, or BPH. It's an enlargement of the prostate that gets worse as men age, often blocking the urethra, producing bothersome urinary symptoms, and interrupting sleep. Dr. David Sussman of New Jersey Urology and paid consultant for UroLift believes men should know their treatment options.
Relief through medication can be inadequate and temporary, with significant side effects such as dizziness, loss of libido, and erectile dysfunction. Now there are new options such as the UroLift system, a minimally invasive outpatient procedure for BPH that in the pivotal FDA study did not cause new sustained erectile dysfunction and offers rapid relief and recovery.
Common side effects are mild to moderate and typically resolve in 2 to 4 weeks. Results may vary. Visit urolift.com today to find a urologist near you and see if the UroLift system procedure is right for you.
It turns out that some people may not eat their vegetables because of their genes. A new study presented at the American Heart Association Scientific Sessions 2019 has found a specific gene variation that makes vegetables taste extremely bitter. People with the gene are more than 2.5 times as likely to eat only small amounts of heart-healthy vegetables as other people, according to study author Jennifer Smith of the University of Kentucky School of Medicine.
Taste is an important factor in food choice, and people with this gene are called super tasters. They perceived a ruin-your-day level of bitter when they tasted the test compound, so they're likely to find broccoli, Brussels sprouts, and cabbage unpleasantly bitter. They may also react negatively to dark chocolate, coffee, and sometimes beer.
Smith says you have to consider how things taste if you really want your patient to follow nutrition guidelines. Researchers hope to use genetic information to figure out spices that can appeal to super tasters to make it easier for them to eat more vegetables.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
Homeless people really are us. They're just a much, much less fortunate subset of us.
Myths about the homeless and why we want to blame the victim.
Then a beauty guide for women with cancer.
Let's face it, listen, you're still living. You want to look good. You want to have a sense of control and kind of feel like yourself.
All that and more on Radio Health Journal.